Bismillahirrahmanirrahim. Ladies and gentlemen, good afternoon. Hope you are doing well. Ladies and gentlemen, today we will discuss generalized anxiety disorder. By the way, we all have some problem in our lives. Sometimes we become worried over things. It's a routine matter. For example, if I know that my children are alone at home, maybe I will be worried about that. I feel anxiety. If I know that I have to present some sort of material at front of my colleagues and boss, maybe I'll be worried about that. I feel anxiety. But there are some people who get upset about almost all things, and they get upset and become worried over things. Those are actually not threatening or problematic. These people known as patient of GAD. For example, now I am talking about the patient of GAD or the characteristics of the patient of the GAD. For example, these type of people got up early in the morning and go to washroom, then definitely they feel anxiety. When they go to office, they feel anxiety. They don't know why they are worried about that and what is going to be happening in their life. If they are going to office, they don't know what will be happening in the office. If they are going to present some material at front of their boss, they don't know that what will be the reaction of his or her boss. So these people don't know that why they are worried and what is going to be happen. They became easily upset about their children, about their family members, about their job, about their wife, and so on. They feel worry or tension. During worry or tension or anxiety, some of these symptoms, those I will discuss later on, some of these symptoms begin to appear in the patient. For example, excessive worry or tension, irritability, restlessness, muscle tension, headache, sweating, trembling, difficulty in concentrating, poor attention span, trouble falling or staying asleep, accelerated heartbeat or heart rate, shortness of breath, and dizziness. These are all the symptoms can be found in generalized anxiety disorder patients or clients. For diagnosis, the symptoms must be present in any patient for 6 or more than 6 months. Okay, now we will discuss the causes of GAD, causes of generalized anxiety disorder. When we talk about the etiology or causes of generalized anxiety disorder, literature suggested as number of causal factors, for example, genetic factors, biological or medical factors, environmental factors, or personality factors as well can contribute in onset of generalized anxiety disorder in human being as well. Okay, we will discuss all these causal factors one by one. So let's start from the genetic factors. Researchers claim that GAD runs from family to family. If a person has GAD, it is quite possible that their children may also suffer from GAD. This is genetic. It means GAD tendencies runs in families as well. Now we will discuss environmental factors. Research findings also suggested that learning play very important role in onset of GAD tendencies in anyone. For example, if in a family a person has long-term GAD tendencies and other family members or his children are observing that patient for a long time, this is quite possible that they have a chance to develop GAD symptoms in their own self by observing long-term symptoms in his dad or mother or brother or sister and other family members. As in observational learning theory, Albert Bandura claimed that people learn the behaviors by observing or watching others. So, when we talk about social learning theory, so it is coming in my mind and it should be coming in your mind that the behavior of any member in the family can become the cause of onset of GAD symptoms in anyone in the family later or sooner. Okay, third cause of GAD is medical or biological in nature. As you know that a number of chemicals exist in our brain and play an important role in maintaining and running of our behavior. One of the chemical which considered as responsible for creating GAD symptoms is known as serotonin. Serotonin is a neurotransmitter which is responsible for mood regulation. Research findings claimed that deficiency in serotonin neurotransmitter in neural or brain pathways can become the cause of triggering of GAD symptoms in human being as well. Fourth cause of GAD is personality of human being. Personality factors playing very important role in onset of GAD symptoms in human being. People with temperaments like behavioral inhibition, neuroticism and harm avoidance tend to be more prone to suffering from GAD as compared to those people who have not these type of temperaments which I have discussed in this slide. So it means that personality factors or temperamental factors or personality traits are also very important in onset of GAD in human being as well. Now we will discuss the GAD treatment. So there are two main important treatment modalities used for the treatment of GAD patients. First is medical. As we have already discussed that the deficiency of serotonin. Serotonin, I have already discussed, that's the neurotransmitter which is responsible for regulation of mood. So the deficiency of serotonin can become the cause of GAD. So physicians, psychiatrists and other mental health specialists prescribed SSRIs for restore and make sure the balance of serotonin in neural pathways of the brain. What is SSRI? SSRI means selective serotonin reuptake inhibitors. This is SSRI basically, it's a class of drug, antidepressants class of drug which used for the treatment of the depression. So what is the function of SSRI? SSRI basically inhibit the reuptake of the neurotransmitter from postsynaptic neuron toward presynaptic neuron. I will now discuss the communication between neuron here, but that was very important, that what is the mechanism of SSRIs. So SSRI inhibit the you can say a reuptake of neurotransmitter from postsynaptic neuron to presynaptic neuron. So second option of treatment of GAD syndrome, or you can say the symptom, not syndrome but symptom, is counseling and psychotherapy. Psychologists try to find out the negative thought patterns and replace these thought patterns with positive thoughts in the patient of GAD. In the meanwhile, psychologists or other mental health specialists also provide the counseling facilities to the relatives of the patient, to the spouse of the patient, to the children of the patient, to the other family members of the patient, and teach them how they can contribute in the betterment of health status of the patient and how they should deal with the patient and how they should accept the patient in broad sense of the well-being. Now we will discuss the prevalence, development and course of GAD. Generally, in all over the world, 0.4 to 3.6% people suffered from or suffering from GAD on yearly basis. Lifetime risk of suffering from GAD is 9%. It means that every person in the world have 9% chances of onset of GAD in whole life. It is more common in females as compared to male. Almost this is twice in females as compared to male. One thing is very important, that the prevalence of the diagnosis peaks in middle ages. I will discuss later on that what is the average age of you can see on the slide on your screen that the average age of onset is 30 years. At the age of 30 years, before 30 years, it is very rare onset may occur in the adolescence as well. Average age of onset of GAD is 30 years. And the prevalence of the diagnosis peaks in middle ages and declines across the later years of life. It means that middle ages there are more chances for the human being to suffer from generalized anxiety disorder, and with the passage of age the chances of onset of GAD symptoms is going to decline onward as well. So ladies and gentlemen, that was all about the GAD. We discussed that what is GAD, what are the symptoms of GAD, what are the causes of GAD, what is the prevalence, what is the treatment, development and course of GAD. So I hope this lecture will contribute in enhancement of your knowledge regarding GAD literature. Hope inshallah I will try to my level best to provide you a lot of information regarding other psychopathologies, disorders and mental health issues. I request for prayers. Thank you very much. Allah Hafiz.